My name is Dr. Joshua Colby. I'm an emergency physician here in Prince Edward County. I grew up north of Toronto in a small town called Alliston in a family of four. I had a twin brother and two sisters. My mom was a teacher, my dad was a linguist. Spent most of our time in the fields and rivers. I decided to go into medicine because I liked science and I liked people and I wanted to live in the country. As part of my training at Queen's University, I came to Picton and did 4 months of family medicine and emergency medicine with a very collegial group of doctors. So I called my wife and I said I could see living here, and she said I could see living there too. I chose emergency medicine because it suits my character well. You get to help people every day. There's a lot of diversity in cases. The residents really enjoyed working with Dr. Christie and I, and we have taught probably over 100 residents that practice medicine all across Canada, and that's a great part of my job. Working during COVID initially was stressful. I was impressed by how brave the nurses were. They would just tromp right into the rooms with patients that had COVID and look after them and stay in their room 45 minutes, an hour, 2 hours. Well, quality healthcare, it means that patients have healthcare first and foremost. So accessibility is an issue. One thing this hospital will help with is recruiting doctors, because they do want to come and work in an uplifting place where it's very dynamic and modern and efficient. There was a kind patient that came through and she nominated me for a Care Champion Award, which I very much appreciated, because when you go to emerge, you're sick or you're injured, it can be very stressful. So in this particular case, we just did our best to make the person feel at ease. During the summer, the hospital's overwhelmed with tourists, but also during the off-season, we're getting busier. We have more people who are retiring here who are generally in a place where they need health care. So a lot of work has gone into making this hospital beautiful and uplifting. It will be something the community can take pride in. The foundation has been really helpful with things that we need in the hospital, as well as the hospital itself. The hospital auxiliary and the hospital foundation worked together and bought us a brand new ultrasound. It was something that wouldn't have been funded by the government. Since then, it's saved countless lives. I've always balanced medicine and music. We love the county because there's a lot of music, there's a lot of venues for such a small place. I'm entering the last decade or two of my career, so I'd like to enjoy teaching emergency medicine, seeing more young doctors and nurses move to the community. So when you invest in the hospital, you invest in the future for everyone.